fast talk should work. I got it plugged in, but whatever works for you.
I've got this coming now, so. Oh, hi, I was right behind you.
Oh, sorry.
No, I can move since you need the, straight on
Yeah.
thing. Yeah. Oh, you all set there?
Pretty helpful next 24 hours.
Well, he thinks it's good. The plug going into it, somebody had pulled out the back and swapped it, so you might want to check it. You guys get it?
Yeah.
Oh, you're only one.
Thanks, John.
Yeah, yeah.
There we go.
Well, I think watch it. I think it's stay on. Yeah,
Very clever. It's supposed to have tiny, but we can tell we got 1,000. I think how 88, here's the film. So we can, which doesn't touch that. We'll wait for the. The binary, they did figure out and optimize it around 16, the binary thing, so it should be 2 to the power. So 8 or 12, 8 or something. Well, actually, they came up to 25. And so, I think part of the challenge of rear were the first time to get 2,000.
Pat, here. Can you hear this?
Oh, I just plugged in over there.
You are? Oh, okay.
We weren't sure, so.
Yeah, I've not seen it.
Well, that paper you sent to me, in some ways, it's statistical, it's almost like when you do a moment and you go to who falls in the past.
It might not, I mean, it should be on.
Well, it's like this probably is.
Well, that broke,
I know that ours
so the mayor just stuck it in there.
So you do 1,000,
We need to stand for at least half, that's why I didn't see what was coming from it.
I don't think it's just this one. Test. Oh, gosh, that's bright.
I'm gonna swap to sorry.
I can try turning on the recording equipment
The
either.
state's even up to last week, there was a 2,000.
Test, 2, test, 2.
Did it work?
Was that phrase, turning the corner? Yeah.
Nah.
That gets used a lot these days. Thanks for coming. We're going to do the.
Are you getting anything out? Or you just took it off?
I took mine out, yeah, I didn't see.
Anyone? Mayor, the live stream's running.
Okay. Sure. I'm going to do this. Oh, I'm super. Everybody ready?
One moment.
Your audio level's good?
Yes.
Okay. Thank you all for coming. There's a few things we'd like to update you on. We're going to leave the discussion of our new website and its features and parking till the end, because I do have a number of guests here that can answer any questions you may have about the city of Plattsburgh and our COVID. These include John Rupp, our engineer, who's been putting in place quite a novel system for monitoring. President Yeti was kind enough to come from the campus to address any questions or concerns you may have about some of the innovative things they're doing. And of course, Clinton County Health Department Director John Canoza is here with us as well to answer any questions you may have from his perspective. I think we're all going to send to you a very similar message with regard to COVID. Yes, we're seeing a lot more cases, about 63% increase in cases in October alone compared to the previous 7 or 8 months. But I think the tone we'll all send is that this is being managed incredibly well, incredibly efficiently, doing an awful lot of contact tracing and really isolating those populations incredibly effectively, to the point where we're convinced that we need to continue doing exactly what we're doing, and but very closely monitor it. And we're going to be asking the public to be very vigilant, especially in wearing their masks, social distancing, etc. I think a message that we're all going to send. On the city's part, we're not intending to do anything differently with regard to our meeting in the building, etc. Very early on March 16th, you recall, we imposed quite a strict protocol where we asked a lot of our employees to work from home if they could. We changed our meeting structures to have people come in only if absolutely necessary. We did accommodate everybody, but we also moved as much as we could to Zoom. Since then, we've refined that protocol, mask wearing throughout the building, social distancing at all times, and it's been working quite well. And we'll continue doing that, but we're also going to be very closely monitoring any additional increase in positive rates in the county and adjusting accordingly based on the best advice from the Clinton County Health Department. The other thing the city started discussing back in June also was testing at our wastewater treatment plant. We're now doing a number of tests each week and been monitoring that since September. And Mr. Ruff can answer any questions about that. We did notice, as everybody's been noticing and all the various testing regimes have been noticing, quite a large increase throughout the month of October. But it's now starting to peak and then level off slightly near the end of October. We're going to continue doing that testing as well. We've obviously got a population that is following the mask wearing policy. As you recall, from April 2nd, we imposed the earliest mask wearing policy for any city in the country, actually, and we're really pleased with the degree to which our citizens are following that mask wearing policy. But we really ask you to maintain your vigilance and if anything, accelerate your efforts, especially among young people. And especially now that it gets colder, people are coming inside. The big issue now is not large outdoors groups that are assembling, it's small indoor groups that are assembling. So we're really asking you to please confine your social gatherings to your household only. We're not making a sort of executive order on that right now, but please be very cognizant, especially as Thanksgiving is approaching, and we don't want to have the outbreaks facing the rest of the country also occurring here. We've been doing a lot better than the rest of the country. The other day, on Friday, Worldometer counted more than 100,000 cases in the United States alone. To put that in perspective, China, with a population of 1.4 million, has less cases in the entire country over this entire period. And we exceeded China's total in the last 9 or 10 months in one day alone in the United States. We're very concerned that within the United States, and even to a lesser degree about in Quebec still, just north of us in Manitoba, they're having problems with outbreaks, much worse than we're seeing at all here. But we need to stay vigilant because we are able to avoid that exponential increase, and we want to continue avoiding it here through all the various great work that our residents are doing, the great work with contact tracing that the Clinton County Health Department is doing. And I'll leave it to President Inyeti to describe what he's doing, but he's got an incredibly novel system going on with pooled sampling on the campus. Would you like to come and discuss that for the listeners? Thank you.
So good afternoon, everyone. I want to just rely on some notes that I brought with me today just to make sure you've got the data. I want to just walk you through a few things. We went through 7 weeks on campus without a positive case, and beginning on October 12th, we saw our first case on campus. I'll break it down to the 3 periods. October 12th to October 18th, we saw 10 cases. October 19th through the 25th, 23 cases. And this past week, October 26th to November the 1st, we saw 6 cases. And if you're mapping the trajectory of that particular curve, it has a shape like this. So it's an upside down bell curve. This is great news, but I cannot take credit for it alone with respect to the work that we're doing on. I need to acknowledge the support and the collaboration that's happening between the city of Plattsburgh and the county's Department of Health. Specifically, I need to thank John Canosa, who's sitting over here, and Nicole Lewis, who's the supervising public health nurse here in the county, along with others at the health department for the phenomenal contact tracing to date. It's been essential for us to help not only to contain, but to isolate the individuals who have become infected with COVID-19. And again, as the case numbers I've just described to you indicate, there's been a successful effort right now to contain, and SUNY Plattsburgh so appreciates the participation and certainly the collaboration of such great community partners. Also need to thank the Mayor's Office for the support through the Plattsburgh Police Department to really help our local UP on campus to discourage large parties or gatherings. And I would mention that the cases that I just described to you since October 12th are not connected to any party or any large gathering. These are just essentially, as the mayor has described, small house gatherings that result in what we would call community transfer. The final 3 weeks of in-person classes begin today. On November 20th, our students will depart for home and Thanksgiving. We have a departure testing plan that's been developed, and we'll be releasing that later this week. The plan will be to test all of our off-campus and on-campus students on November 11th, 12th, and 13th. And this is in alignment with the SUNY's guidelines that were published last week with respect to the expectation for departing students. With respect to quarantine, we currently have 41 students in mandatory or precautionary quarantine. 16 of these are on campus and 25 are off campus. And we also have 10 employees in mandatory or precautionary quarantine. And we've had 2 positive employee cases in the total number that I've described to you earlier. With respect to isolation, and these are individuals that are COVID positive, we have 15 students in isolation at the moment. 6 are on campus and 9 are off campus. Our capacity for INQ, which is isolation and quarantine, we have 240 rooms still available on campus. We have made some internal adjustments on our campus to increase that size. And essentially, we have some students that are in quarantine, but because it's based on limited contact through classrooms, they're able to stay in their existing rooms with restrictions. What the mayor mentioned earlier was testing, and testing has become the major effort that we've embarked on campus. We're doing something called pool surveillance testing. It's a RT-PCR, reverse transcriptase polymerase chain reaction test that takes 12 samples, combines into one tube, and you can then run that sample to see if there's a positive. We're able to run 1,000 samples in one particular testing day, and last week, for example, we did 1,416 pool tests, and we revealed 1 positive case, and those were all on-campus students that we were able to test. So far, we've done 7,224 pool tests on campus, and that's essentially over a 9-week period. We're going to do 2 days of testing tomorrow and on Wednesday. That will target the off-campus population, and as I've already mentioned, November 11th through the 13th will be both on and off campus. So the last thing I'll just mention is that we are going to continue to stress vigilance. We're going to tell our students and tell our members of our community to avoid large gatherings. Always wear your mask. Ensure that you social distance, and if you're sick, stay home. That's the most important thing. A lot of folks feel they have to, be the person that comes to work or comes to school. If you're sick, just stay home. And most importantly as well, if you come into contact with someone who's COVID positive, stay home as well. There's a high probability that you will be infected. And the last thing I'll mention, if you need more data, go to the SUNY Plattsburgh COVID-19 dashboard, which is on our website. and the SUNY COVID-19 tracker website, which is both updated daily. So you can see in real time. And I've made a commitment to the campus. Whenever there's a positive case, I will report that out, whether it's in the morning, in the afternoon, in some cases late in the evening, those information goes out. And the last thing I'll mention, in addition to the great support from the health department, is we have a phenomenal team on our campus, headed up by our health center director, Dr. Kathleen Camillo, our director of emergency management, Michael Carabello, and our chief of university police, Mr. Pat Rasco. So those are all things that I need to cover today. Thanks very much, Colin.
Thank you very much. Mr. Canoza, would you like to add anything from the county perspective? Sure.
Thank you very much, Mayor. Much appreciated. Yeah, I'll just give you a brief update for today. We have some new cases, as we're seeing now. 4 on Friday, 7 on Saturday, and 7 on Sunday. Now, these numbers are a big change from what we were seeing during the summertime, but a lot of it has to do with the mayor said. A lot of people are inside now, especially on cold days today, where I didn't bring my winter jacket. Okay, everybody's indoors these days in congregate quarters and in closer proximity. So that's why we, at least in part, why we are seeing higher numbers these days. So, and we will probably continue to see that as we trek through the majority of the winter. In other news, I can't thank enough SUNY Plattsburgh, the city of Plattsburgh, for all of their efforts, as well as CVPH, the doctors and nurses up there that go on day after day, as well as the supplemental testing site they are running at 213 Connecticut Road at a county large warehouse building there. They're testing anywhere between 40 and 75 people every day for COVID. Test results are coming in every 4 or 5 days. And we're also ramping up, working with some of our partners, hopefully rapid testing in the near future. So trying to get more of those tests that the state of New York will be offering us. So again, I can't thank everybody enough. We keep plowing forward. It's another day. Weekends tend to be the busiest because that's when we're doing more congregating. And I cannot agree enough with the mayor here that indicated even the small gatherings we must be wary of. Right now we're chasing some cases from a small birthday party that occurred about 5 days ago. So we've got to keep our eyeball out for everything. Please be aware that you need to, be on the lookout for type of situations where you could be in close contact with others. Be wary of that. Stay vigilant. Do not get complacent. Wear the face mask, face covering. Maintain your distance. Probably the biggest one is maintain avoidance of social gatherings. I think that's the most important one right now. So it's unfortunate that it has to come with the winter season, but hopefully we'll get through it without too many other problems. Thank you, Mayor.
City Environment Engineer Rupp, would you like to add anything?
Jonathan Ruff, Environmental Manager for the City of Plattsburgh. At the city's wastewater treatment plant, we've been sampling the influent wastewater since the end of September. We collect composite samples on Fridays, Saturdays, and Sundays and send them to a lab that's operated by the New York City Department of Environmental Protection. They run the tests. They also have experts that have helped us understand the data a little bit. And when you look at the trajectory of the data that we've collected since the end of September, each weekend, you can see that it had a very marked steady increase for several weeks that has seemed to have leveled off. And it seems to track somewhat closely with the number of positive tests that have occurred across the county a little bit in advance. So the interpretation of this type of data is probably as much an art as a science right now, but it does seem to be very useful as kind of a canary in the coal mine. Give you a little prediction of what might be coming in a week or so that you can get the word out to the public and have people perhaps exercise greater social distancing and increase clinical testing if that's a resource that's available. Go, any questions?
When you're tracking the effluent, can you tell where in the city it came from so that you can help pinpoint where the outbreak might be occurring or where the positives might be occurring?
Right. With the data that we're collecting, no. We're only collecting it at the entry point to the wastewater plant. So it would be representative of the entire city, including the college. plus a substantial portion of the town. There is the ability to break that sampling out into different sewer sheds. That hasn't been something that we've pursued at this point in time. Thank you.
At this point, I can open up to any questions for any of our guests or myself on COVID, then we'll jump to the parking and the new website.
I have a question that probably would be best for Dr. Danny.
Sure.
Just want to make sure that you're framed. Okay, before I ask you. Okay, so when it comes to the college students in quarantine and isolation, is there like a check-in process or anything like that? Are you calling them just to make sure that they are abiding by the rules, or is that, I guess, would that be the health department doing that?
So there's a partnership with the health department. So off-campus students are being monitored and checked in by the health department. So from what I understand, they get a minimum of one check-in call per day. And again, they're given the instructions. We also set up a program on campus called Quarantine Buddies. So every student that goes into quarantine or isolation has a person assigned to them who's checking in on them as well. And if you're an on-campus student in one of our quarantine isolation rooms, there's further, let's say, interaction with respect to food delivery and making sure that the students are comfortable with respect to the quarantine.
Are those 14 buddy students or faculty?
They're volunteers, so it could be students, it could be faculty, it could be staff members. And I would acknowledge that we have a great group of students in our Greek life programming who have stepped forward not only to help with quarantining buddies, but also to support the testing that we do as well. So thanks.
Dr. Minetti?
Yes.
A little bit confused with the isolation and quarantine. Didn't the state mandate that if you had more than 100 students and staff, that you would have to, go to remote learning campus-wide? So at one point you were above that, but you didn't go to all remote learning. So why not? What are the actual rules around all of that?
Sure, the 100 is a threshold for active cases in terms of active positive COVID cases. So if you check our, it's on, what I'd say, www.covid19 SUNY Plattsburgh, and that's probably not the exact website, but you'll find it. We're sitting at approximately 7 towards that number of 100 at this point in time. So that's the number that's the number that's used to determine whether we go to pause or stay open.
So the people in isolation and quarantine aren't quote unquote active?
So the individuals who are in isolation are active for a 2-week period. So the system is using a 2-week rolling average with respect to the number of cases. So I mentioned to you that our first case appeared on October the 12th. That individual has now gone through isolation and has recovered, feeling much better, and they're now released. That's the technical term that's used. And they're part of the back to the population. They're no longer COVID positive. They no longer serve as a source of virus. Thanks.
Any further questions on COVID? Well, thank you all. Appreciate your coming. You bet. And as we talk, remaining 2 items, we're going to talk a little bit about our new website. That was done in collaboration with Clinton County, one of our shared services. It's online now. You can actually see it right in behind you, and it's also in the lobby computer on a steady loop. It's very easy to get to information much more quickly, so we're very happy with that, and we're grateful that Clinton County could collaborate with us to produce this. Before this, we went out of house to have this work done, and there's often large delays in innovations and that sort of thing, so this is working out very, very well. We modeled our website on Albany. City of Albany has a very efficient website, allows you to get to just most everything you can imagine with only 1 or 2 clicks. So please take an opportunity to check that out. We're migrating all the people who wanted alerts from us through emails, etc., to this new system, and we're working to see if NY Alerts, which you may be familiar with, can also handle text messaging on our behalf. We're going to look for some text solution as well. And so this is everything we had in the previous system and more, and a lot cleaner and much easier to get to and much more friendly to smartphones. Near the bottom left-hand corner, you'll see on this something called OpenGov on the bottom of that second column. OpenGov is now live. That's the system we had that allows you to very easily go in and check all the various finances and other things for the city into all kinds of detail. It's just about live for data as of the date. It's current from about a month ago at this point. September 20th, I think, was the last revision, but within the next day or two, it's going to be up to date to the very day. It integrates with our Munis software and allows you a much nicer interface for that. So do go and check that out. Are there any questions with regard to the website before I talk about the last subject of parking?
I remember quite a while ago, the OpenGov folks were up here for the demo.
Right.
Did it take so long because of COVID, or just was it a complex transition?
Well, both. COVID delayed it a lot. You may recall the rollout was just before COVID, and then all of a sudden everybody kind of were working at home. It's very hard to get everybody all in one place to work collaboratively on it. And then to integrate with the way we do Munis and the way they need to draw data, something to do with server access and various ports and all that kind of stuff that had to be finessed. And then they've been adding new bells and whistles as well, so they wanted to add those. So I think we're just about there now, just have one or two more things we want to complete, but it certainly is a nice working version now. So please check that out.
Can you talk about the cost of OpenGov? I can't remember those numbers.
Just roughly, I think it costs about $15,000, if I recall, per year. Our website alone used to be around $12,000 or something per year, was it? Beth, do you remember?
She was talking about OpenGov.
Yeah, and I'm just trying to think of
sorry.
the whole combined presentation cost.
Yeah, the new website is 12,000 for 2 years. So
Yeah, so the new website's about half the price for 2 years, and then down to the matter of hundreds or 1,000 after that. County is spending a couple of years developing it. So the total cost to the city for OpenGov and for the county shared services, once everything stabilizes and we're through that kind of phase in, should be pretty similar to what we were paying for just the website alone previously. So we think we're getting a much better website and a lot more bang for the buck and a lot more data available to the public because of that. And again, a lot of the credit goes to the county for working with us on that. It's part of the shared services program that you're all familiar with that the governor had sponsored. So we actually get a rebate of half of the savings for the first year of the program from the state as part of their shared services incentive program. Then the last thing, we're announcing we're opening up some more parking for evenings and weekends and snow emergencies and that sort of thing. We realize that the lot we use just off to the side of the building here could be better used if we allowed people to park there at nights and weekends and holidays as well, so we've made that available. We've made available a few more spots on Lower Cornelia Street here as well, on street. And MLD, which still owns the Miller Street building, were gracious enough to allow the public to park in 11 spots at that location, just across the street, kitty corner to City Hall as well. So we feel that will serve us very well, the kind of the northeast side of the downtown, including this stretch along City Hall Place, the restaurants. We had the collaborative project with the county, and you can see these various things on the map here actually. We had the collaborative project with the county to create more public spots in the county lot, and then they moved some of their demand for public spots and street parking off into the Oak Street lot as well. So we net about 74 new spots because of that shift, the shift in county operations, the building of those new spots. Pavone lot is now open with 103 spots there. Broad Street is now open with 21 new spots there. And we still anticipate in the Durkee footprint itself. Within the old Durkee lot, after the development is complete, there'll be 50 spots still for the public there. And then in the two surrounding streets on Durkee and Bridge Street, there's going to be another 44 spots for public parking in addition to what already exists today. So it's going to be about 100 spots down there as well. So Turns out we've got the same amount of parking during the day and actually more parking at night and weekends than before once Prime is completed. Now, as you can see, it's spread out from the northwest to the northeast to the southwest to the southeast corners of the downtown. And then our Trinity lot and our Court Street Cumberland Hotel lot still right in the heart of the downtown as well, very centrally located. So hopefully that's spread all the parking all across the downtown rather than being concentrated just on one corner of downtown, with the same number of spots available during the day and 25 more during the evenings than before. So that's parking. Is there any questions I can answer on those subjects or anything else you might be interested or concerned with?
In the new alert system, do you foresee that being used as a way to give out emergency alerts with COVID-related concerns?
It could be. We use the website when we're most concerned about COVID, when we're really starting to go up that exponential curve and really need to bend that curve. Back in March and April, we used the website quite a bit for that, right into May. And then once everything started leveling off, started in the summer months, as you can see, there hasn't been much activity with that. So we haven't used the texting alerts for COVID. We've used just the website itself for COVID information. We anticipate that texting would continue to be used for boil water notices, snow emergencies, that sort of thing. There's only about 250 people that have signed up for actual text alerts on our system. Many more for email alerts. I think that's the preferred way, and those will continue as usual as well.
I have a question about the water waste, if that's okay. What are some of the benefits of doing this?
It's a really good pilot project that will tell us very early on what the overall level of disease is in the community, and we can track that and see that it's rising well before people even become symptomatic. And so that, as John or Dr. Agneti had mentioned, is a kind of a canary in the coal mines, a very early indicator that then causes us to be much more attuned, maybe ramp up additional PCR testing, more pool testing as a response to that. So we've been trying it for about 5 or 6 weeks now, and we anticipate that it would be helpful. We could then start testing more locally. We've got our sewer system converging down to the wastewater treatment plant from a number of different directions, but we can sample from each of those directions separately, including, for instance, at the university if need be. So we haven't gone quite that far yet. We want to perfect this and get the testing regime going, seeing if that additional testing would be helpful. And it looks like it is, and we're working most closely with SUNY on this. So I hope to roll out more yet. But this isn't something we invented. There's some innovative communities that started doing this. I found out about it last June from an innovative community that started adopting this, and we started on producing a protocol very quickly after that. I would hope that all communities with wastewater treatment plants should start doing the same thing. It's relatively low cost. It's a great amount of information that can really heighten your awareness and let you know what's coming. And we really saw the ramp up. If you look at the data, as you know, October is starting to really take off, and I fully expect, and I think a lot of scientists fully expect, this is going to take off even more. I heard an estimate of approaching 400,000 cases by January nationwide, 400,000 deaths, pardon me, nationwide by January. So we see that accelerating. If you look at the graph, our average cases per day are more than twice what it had been for the previous 6 months. So we're getting up there now. We have to see if we can start bending that back down like we managed to do back in April and May nationally and locally as well. So any bit of information to show you what's coming, I think is very helpful, especially if you can do it from everybody through wastewater and not just rely on people who feel sick and then going out and getting tested. By then they're already a week or two down the path.
Does anybody else have any questions before I ask? My boss wants me to ask you a question,
Sure.
so I will throw it out at you. He would like to know who you're voting for mayor.
I'm going to vote for one of the two candidates that are standing for mayor. As you know, I decided not to pursue a run as an independent candidate, and I'm trying to get as much done as I can possibly get done in the remaining, 8 weeks as I can. And I hope I can meet most of my objectives in this 4 years. I think there is still some work to do. I hope whoever does get elected understands the seriousness of the job, the difficulty of the job, and the things that we still have to accomplish yet. I hear a lot of discussion of, well, boy, he fixed the finances, don't have to worry about that. That box is checked, but no, I don't think it's checked by any means. I think there's an awful lot of work to be done to ensure the city is right-sized and just simply doesn't fall into the trap that it has done time and time and time again. You know, it's somewhat ironic that you leave it to a Democratic mayor to do some of the really hard, fiscally sustainable stuff, because often the Republican Party prides itself as being the fiscally sustainable party. And yet the last 2 Democratic mayors, one in the last part of the last millennium and me, have been the ones that have been really focusing on bringing the budget under control and actually bringing taxes down. We really feel the need to bring taxes down to the same level as comparable cities in the North Country. And I think we can do it. We've got a plan to do it. But to use that as a springboard to just start falling back into raising taxes and running deficits would be really a tragedy. So that's quite a non-answer for you. But your question was who I'm going to vote for. I'm going to vote for whoever I think is best at doing that.
What criteria are you measuring?
With regard to what I think is important in a candidate,
Yeah, between the two of them.
Fiscal responsibility, being able to articulate a sound budget plan, not a belief that the problem is solved. Sustainability is never solved. You know, we're not going to do a couple of things over the next year with global warming and say global warming is solved. Sustainability is the same sort of thing. It's an attitude. It's a responsiveness. It's just as I see Governor Scott across the lake is arguing his main job is to make sure that Vermont is affordable. My main job is to make sure that the city of Plattsburgh is affordable, and we really got unaffordable for a while. So I would have liked to have seen a lot more discussion during the campaigns on affordability issues, on how we ensure that our residents, especially our elderly residents that are living on Social Security, don't find it necessary to move somewhere else because they just can't afford the cost of living in the city. We're a very affordable city to live in, except for property taxes, and they really are through the roof and far higher than our colleagues in other cities in the North Country. They're the ones we compete with. If we force people to leave because of affordability, we then are required to bring people in from somewhere else to maintain our population. Our population has been going down ever so slightly, but it's been going down over the last 10 years. But the only way we get people to come in is allow them to do the comparison of how much it costs to live in Plattsburgh versus its amenities compared to Glens Falls and Watertown, etc. And Plattsburgh has to come out ahead in that equation. And to be frank, currently we're not. And we are competing with people from elsewhere to stem the population outflow. So that's why I say that sustainability, value, and affordability are the most important issues. With regard to road building, you'll actually see in OpenGov that we're building far more roads. We're maintaining all the various services. Granted, we are doing a little bit different thing to deliver some of these services now. We're relying much more on public-private partnerships, especially in recreation. We're so pleased that these various groups are coming forward and wanting to partner with the city to maintain that sort of continuity. But we need to figure out ways to do things in a more imaginative way. Past years when we just felt we could raise taxes and run deficits, it's turned out that that's just not a solution. And ultimately, it ends up threatening the services that we provide rather than enhancing them in the long run if we don't maintain our vigilance. Anything else? Well, personally for you all, please stay safe and please keep exercising the social distancing that's done so well for us. I'm very proud of the community. If you look around us, you're all wearing masks. The people you see in public, for the most part, are wearing masks. When you go to the grocery stores and the building supply stores, etc., they're all wearing masks. There's so many communities in the country that aren't doing that, and they're suffering, and we're not. And the reason is because of all of us. So please keep it up, and please keep that message going in the media, just how important that is. We've only lost 5 lives in the city of Plattsburgh so far, and that's incredibly low number compared to all of our peers. And let's keep it that way, especially with the holiday seasons coming. I know this is going to be really rough nationally and internationally. 500,000 cases a day internationally, and we now saw our first 100,000 case a day nationally here. I just don't want to see any of that happening. That's 10 to 20 times worse than it is here, by the way, on average, but I don't want to see any of that here, so please be careful. Thank you.
Thank you.
I've got a few more copies of the raw data from